Hey guys, this is Amanda Bassingthwaite and Kelly Howe, and we're back to talk to you about Wednesday's topic for Public Health Week. And today we're talking about rural communities. I always have a terrible time trying to say rural communities, but we're here to talk about the health in rural communities. And it is a proven fact that we have higher chronic disease rates, or we see higher chronic disease rates, such as heart disease, cancer, and stroke in these rural communities, and also a higher rate of unintentional injury in these communities. We also see a lot of transportation issues in these communities as far as getting access to health care, which could be a contributing factor to where we see these higher chronic disease rates. We also see a higher rate of opioid addiction in these areas, and we've also seen an increase in overdose deaths for opioid. And one thing we've really gotten on board with as a health department is the naloxone distribution, or you may know it better as Narcan. And we've spent a lot of time working with law enforcement and emergency services to make sure this is available within our community. But I'm going to let Kelly talk a little bit about that and how we've served as a health department in distributing that in the community.
Sure. So the Christian County Health Department has partnered with our local ASAP board, which is the Agency for Substance Abuse Policy, and we are working on a policy to distribute Narcan into the community, into our volunteer fire departments,
Yes.
the search and rescue squad, as well as other people who may come into contact with people who are at high risk of an overdose. And so,
Didn't our epidemiologist, when we were talking about it, said we delivered, or emergency services administered over 100 doses of Narcan last year for opioid overdoses. So it's definitely a need in the community.
yes. So, and once we get this policy in place, we will be distributing the Narcan, and hopefully that will help save some lives that may be at risk of overdose exposure.
So a lot of these issues, like I said, are happening in the rural communities. So how can you take an active interest in health? Well, one of the things that we've seen in our community that was the new transportation services. New as in it was implemented about 3 years ago. But this has been a great resource in the community to get these rural communities or the individuals who live in these rural communities access to health care through the transportation services. You also see the PACS organization. They go out throughout the county and pick up individuals who need transportation services and drive them to the doctor's offices. So that's a great resource in the community to provide these individuals with access to health care. We also have what we call telehealth that we see a lot more in the community, and that's where individuals in these areas who may not have access to go to the doctor can access their doctor via phone in a video conference call. So that's a great resource that can be utilized in the community now. And we also have social media. We see a lot of social media platforms where people are gaining more education on health and wellness and how they can better care for themselves. So if you're in the community and you see these services, advocate for these services, promote these services, tell people about these services so that we can ensure everyone, whether you're in the urban areas or the rural areas of the county, can get access to these services and get access to these preventative health care services that we offer to better their health. So if you have any questions about anything we talked about today, you can always give us a call at 270-887-4160, like us on our Facebook page, or go to ChristianCountyHD.com. Thank you.